Yeah, hello, good day. Welcome to another segment of Happy Home Marriage Talk Show. As you all know, it is not how big the house is, but it's how happy the home is. My name is Adebayo Ablative, and today we shall be discussing how marital trauma can actually lead to mental disorder in marriage, most especially in women. And today we shall be discussing with Dr. Zainab Suleiman, who is a consultant psychiatrist at the Federal Neuropsychiatric Kaduna. Doctor, good afternoon.
Good afternoon.
Yes, ma'am.
Yes.
There have been so many complaints, so many arguments, issues concerning women, surrounding women and their mental health. Are marital traumas and mental disorder the same?
Thank you very much. You're welcome
Thank
again.
you.
I'm happy to talk about this topic. And why is it apt now? Because this week is Mental Health Week.
Wow.
October 10th is the day marked out for mental health.
Okay.
And what is the significance? The significance is creating awareness among our people. Mental health, there is help, there is hope. It is unlike those days that people believe that once you have a mental challenges,
Yeah.
you are condemned.
should be pushed aside.
You should be pushed aside. It's no longer like that. There are drugs, there are several ways of managing people with mental challenges. And why am I saying that this is coming at a very significant time? It has to do with women. And women is the chain
Yeah.
to father, to men, to children.
Children.
It is the link to nature on its own. So that's why I'm saying it is very, very important. The theme for this year is prioritizing mental health at workplace.
Okay.
And I will say, even in the home, I think in quotes is
Very,
the
very,
workplace.
very important,
Yes,
yes.
because everything happens from home.
Oh.
When home is not settled, of course, the workplace cannot
Settled.
function well. So going back to your question that if a marital
Trauma and mental disorder are
is
actually the same.
Yeah, I would say no to
Okay.
that because they all have their different definitions.
Okay.
What is marital trauma or relationship trauma?
Okay.
It has a definition.
Okay.
Let's define it. Let's look at it broadly. It is the physical, psychological, emotional harm that occurs in query a romantic relationship. You understand? Why did I say query a romantic relationship or an intimate relationship? We assume marriages, relationship should be fine, harmonious,
Yeah.
we should be happy, rosy, but it's usually not like that at all times because of some differences that can come in. And then why am I saying that it is different from mental disorder? Mental disorder is a condition
Okay.
that has to do with people's feeling,
Okay.
emotion, psychology, their behavior, it changes. You understand? Their thoughts, their emotion, how they respond to things, situations around them. So it is different. Causes of mental disorder is different from it's different, but of course the relationship is still interwoven. Yes, you can't really separate it. Okay. Why I say that? Because marital trauma in a way can predispose people to mental disorders. Okay. And of course, mental disorder can also be a precipitant for marital trauma, relationship trauma.
What are some factors or conditions that can actually that can constitute the traumas in marriage?
A lot of factors can come into play. Okay. Thank God you're a married man. The economy. Everybody you ask is talking about the economy.
Yeah.
Of course, there are internal factors. Okay. There can be external factors. Okay. Some internal factors might have to do with the psychology, emotions. You understand? Communication. How do we communicate in the home? Among ourselves, among spouses. What are my personality? What are the personality? I'm made up of certain personality. You are made up of certain personality. Yeah. We grew up from different environments and then we are coming together to build a home. So we have our own individual differences initially. And then mental illness also is a condition that can also lead to marital trauma. Okay. Because a woman, for instance, or a man who has mental illness, it is possible that it happens before the marriage, and it is possible that it happened within the marriage. maybe few years, maybe during first childbirth or pregnancy, first pregnancy, because women are predisposed. Some women, a percentage of pregnancy can predispose women to mental disorders in pregnancy. So when people don't understand that these things, this stress can actually culminate into this, they tend to start having blaming games. Oh, the family didn't tell us that she had mental illness. And then the lady's family will put the blame on the husband. Possibly he has traumatized our daughter.
Yes.
That is why he's coming down with mental illness. We don't know what's happening. She won't talk because she's not communicating. She was there suffering, and So then another issue is family interference. It does a lot. It has a lot of role to play. It's possible maybe the mother-in-law never liked her, or the father-in-law never liked
or the
him.
sister-in-law.
Yeah, the sister. So of course, when they come together, there will always be those little issues that comes up, and where there is not enough understanding between the man and the wife, of course, they are going to lean towards what the family advises, what the family are advising him or her about. So all those things can also bring about issues. Then, like I said, communication is key. Communication. And then other challenges, economic challenges, we have said it. It's in this era now, we know how it is in the family
to survive.
It's very difficult. You're working, everybody's working, the wife, possibly the man, maybe the wife is not even working. Or it is the woman that is the breadwinner of the house. So she tends to get irritable at every little thing she assumes is a waste, or being taken advantage of, or he. So,
but doctor, let me just digress a little bit. With the economy, with the situation of the economy in the country now, who should be affected more? Is it the woman or the man?
Everybody's affected. Honestly speaking, I must tell you, everybody's affected.
We're all players in it.
Yes, everybody is affected.
So, what are the common signs for one to know that he or she is actually going through trauma that actually lead to a mental disorder?
Yes, there are common signs. You know your wife, you know your husband.
Yes.
There's a deviation.
Definitely.
We've been having issues. And then all of a sudden, this man or this woman is somebody who initially wasn't a calm person. Let me describe the person as a calm person. Wasn't a temperamental or easily irritable. You understand? But all of a sudden you notice that he becomes highly irritable now and flares up at the slightest, at any given opportunity, even when it seems not to be necessary. The person is on edge. Anxiety is one of it. They cannot sleep, poor concentration, poor memory, even ability to take care of self becomes very difficult. Somebody who was loving, cheerful, all of a sudden is now deviating from whom they used to know. And then sometimes it can progress further. You can start feeling fear, having heightened emotions, easily startled, poor sleep, with nightmares, night terrors. You understand? They relive the memories of the sources of trauma. You understand? Then the incidents around it, if it was physical, verbal, sexual, in any form that it came. So they become so afraid. And then sometimes you see them isolating themselves. And sometimes people have taken into using other coping skills that are maladaptive, like alcohol, using substance. Of course, you agree with me that even the married women, they also use substances. And sometimes it might be as a result of marital trauma that they have been going through. But of course, they've not been able to talk to somebody. So you see them mixing all manner of things in their drink to enable them to what? Sleep and have comfort. However, as they keep doing this, the days they need keeps increasing. and then they start getting addicted. So that coping strategy becomes what maladaptive. While the men might be in the beer parlor, the woman is not allowed to be at the beer parlor, but it's allowed for the man to be there. And of course,
most of the useful time
outside. So substance abuse is another consequences that can, one of the signs that one can pick. And then sometimes low mood, depression can start setting in. When we started with fear, heightened emotion, irritability, poor concentration. If it is not picked on time, or those signs were not picked, and you are not recognizing them as a red flag in the relationship or in the person's life, of course they can degenerate and progress to a worse condition that can lead to mental illness. At that time, we are not talking about depression, which can come with low mood, which can come up with loss of interest in pleasurable activities, which can come with loss of energy. The woman is there, she's not able to keep herself clean. How much more keeping the house clean? She's always crying. Either you're there or you might not be there. She's crying. And some have attempted suicide. And somewhere along the line, somebody has actually committed suicide.
Definitely.
You understand, which we did not pick. Then anxiety disorders are also common among people or among couple experiencing marital trauma. And then also we have post-traumatic stress disorder. And some people have actually come up with frank psychosis, irrational behavior, having hallucination, delusion, even if it might not be that much, because it's more with the affective disorders. So these are some of the signs that one can actually pick.
Okay, thank you very much, doctor. So how can couples support each other to avoid marital trauma in their marriage?
Okay, for couples to support each other to avoid marital trauma issues, don't forget, I said it earlier on, initially, that we are coming from different backgrounds. We've had courtship. Possibly, I will start from there. During courtship, we should learn to understand each other. It is not about merrymaking. It's not about trying to woo and trying to create an impression.
Shawarmas.
Yes, not the shawarma, the say and the chicken suya. You understand? A relationship that we have started planning, that we might get into marriage. It's a different thing to be in marriage. It's a different thing to be in relationship. People should understand that marriage, it's like a serious business. It's reality. It is serious business. And at that point in time, we should also start assessing ourselves, our relationship. What is it about this person that I need to change or that I need to get used to? What is it about this woman that I can tolerate, or that, you are good, she's very good, she's a nice person, but this aspect, there might be need to adjust. Do you understand? So at that point in time, we should be able to start supporting each other from there and start trying to see how we can work together. Then, one important strategy is communication. It's very key. Most homes, there is no communication. And why is there no communication? It might be because of the nature of job. I might not be a talking person when I got into the relationship. He might be the talking type. Do you understand? But then when the stress of marriage start coming in, reality keep dawning on people. But that gap that is being blocked by communication, we should not allow it to.
And communication is the main engine of the marriage.
Is the main engine. Communication. This is the way I feel about this. This is the way I feel about this. We learn to respect each other, and we learn to help each other to boost our self-esteem. Listening here.
So many women feel to speak out, showing their vulnerability is a weakness.
Sometimes, because it depends on the man. Sometimes, don't let me put it as if I'm being stigmatizing on men. Yes, because it can also be the woman. Sometimes you can see a woman yelling at the husband. You talk too much. Why are you stopping me? You understand? It is not a sign of vulnerability or weakness.
Or weakness.
It is not a sign. But we must learn that these are the tools we need to make a home work, a relationship to work. And, being judgmental in a relationship without giving the other person opportunity to air their view, without giving a listening ear for us to listen to their complaints, their grievances, for us not to be able to project and look at and say, okay, what is it? What does she like? Do you understand? I know some of these things, I do it, she doesn't like it. Don't throw clothes all over. And I keep doing it. Of course, somehow it can have a negative impact on the woman because she has the children, she has to go to work. You don't know the kind of boss she has in the office. So supporting each other through the trajectory of that journey is very important. And then couples also need to cut their finances according to their resources.
Okay.
Yes. Undue expectations or unnecessary, unrealistic expectations.
Or some giveaways that
yes.
Yeah, okay.
Unrealistic expectations. This is what I can afford. And you can contribute, I can contribute. We have to understand each other. We have to
come together
take
as a
joint
team.
decision. And then we have to look after each other's welfare. It's very important in a relationship.
Okay, thank you for our viewers who are actually listening to us. We've been discussing marital traumas and how it leads to mental disorder, most especially in marriage. And we'll be speaking with Dr. Zainab Suleiman, who is a consultant psychiatrist at Federal Neuropsychiatric Hospital, Kaduna. And we really appreciate. Lastly, doctor, you said we're actually in the mental week, right?
Yes.
Mental week. Okay. What is it? Mental week or mental?
World Mental Health.
World Mental Health.
FD.
What can you say, most especially among women, the mental illness or mental disorder, is it on the increase or is it actually coming down, or what has changed?
Well, on the increase.
It's on the increase.
Yes, because there are so many factors associated. It is not one thing that causes mental illness. You understand? It's multifactorial. The causes are multifactorial. But there are so many things around now that is not even, you understand, that it's not favorable.
Okay.
The condition is not favorable. So many things coming up at different times. You understand? But the good thing is the awareness keeps increasing. The awareness keeps increasing, and you can't do enough when it comes to creating awareness. It's just, mental illness is just like any other chronic illnesses. You talk about hypertension, we talk about diabetes, you talk about liver disease, you talk about this. Sometimes you do everything possible, but then it still comes up. You understand? So it's just like any other chronic illnesses.
Okay. So how can family and friends actually support people who are actually going through this trauma or mental illness? But sometimes, just like reality, when we started, that before now they're being pushed aside. So please, what's your advice? How can family and friends support people like this so that we don't push them aside? We can always give them hope that no, they can still get better.
Yes. When people are experiencing marital trauma, which we say that if care is not taken, it has a relationship with mental illness. And then we don't want people to get to that stage.
To that level, yeah.
We don't want people to get to that level. Do you understand? We're trying everything possible within the community to bring happiness back to people's home. We want people to have mental well-being. Do you understand? Including their physical well-being. Yeah. Because marital traumas can cause so many things. Physical, don't forget to talk about emotional harm. People have gotten amputated because of marital trauma. People have got blinded. People have either killed and all sorts of things. So the important thing is recognizing it as early as possible. You have a neighbor, for instance. You're always hearing from the house beating. They are beating each other, fighting. Children will be screaming and all those things. And as a neighbor or a friend, of course, sometimes you need to also consider their privacy. But their loved ones, like their parents, I don't think there's people who are more significant in their life than those family members. They can be called upon. to talk to them and settle issues amicably. Then sometimes you also need to invite, even sometimes the couple can do it among themselves. You can see the husband going to report in the family house or in the lady's house, or you can see the lady going to the husband's house to report.
Yeah.
This report should not be taken with levity. Whatever will make them to have stood up to say,
I'm not satisfied.
yes, we should act on it. It is not to blame people. It is not to judge them about what is happening, but it's about bringing support to the home. So when you do that, then significant others like the clergies, the church pastor, the mosque imam, yes, or the social group, the leader of the group where they belong to, you can also invite, they can be invited at different times to interfere. Sometimes it can get bad that the social welfare department are involved so that they don't kill themselves in the house. And then you do this. You do what is within your power. And then you also support them. And then I talked about red flag.
Yeah.
By the time you start having this, there might be a need to talk to a counselor. There might be a need to talk to a psychologist. And they might have to go through some therapy, couple therapy, family therapy. And, by the time you're able to do that, you might be able to, as early as possible, to halt any development of mental disorder. But of course, at that point, there might still be referral for them to see a psychiatrist. But most importantly is family intervention, the role of the religious or faith organizations in the family to assist, and then understanding each other. Okay. Yes.
Well, thank you very much. We've had a very
much.
wonderful session with Dr. Zainab Suleiman discussing marital trauma and how it can possibly lead to mental disorder. And she has said a lot, the causes, some of the remedies to raise, and she talked much more about seeing the signs that okay, these things are not normal. You've been a very fair person, then you begin to change your mood, depression setting, then you should be able to identify these signs on time. Then talk. Don't feel like no. For me to talk out is a sign of weakness. Talk.
So significant others. It's not just people. You don't talk to people that we also mislead.
Mislead you. That's
you understand.
She actually
some women will tell you, I cannot take it. Yes. She will tell you, it's the husband that bought this for me. It is not true.
Yeah.
It is not true. Then you go and start fighting your husband for unrealistic mission. So of course, what do you expect? So talking to people that are significant in our life, professionals, and key religious people leaders in our family, in our lives are very important. Okay. And people don't even look at it from the perspective, the impact on children. It also has its own effects on them. Yes.
The mother is not well taken care of. How will she take care of the children?
Sometimes they go far beyond that because delinquencies and other childhood mental disorders could actually come up. A child might not be able to tell you, relate that this is what I feel, but they can express it physically. Sometimes you see a child who has stopped bedwetting, and all of a sudden they start bedwetting. All of a sudden, after 4 or 5 years, they start bedwetting. A child who sleeps normal, all of a sudden they start having night tremors, they start having night tremors, they start having nightmares, they start becoming inattentive in class, poor academic performance. You understand? It's usually a red flag that something is happening in that family or to that child. And if it is not properly looked into, it can become worse.
I think that's another angle we need to look at, most especially with parents. How much they pay attention to this aspect of life of their children.
Yes.
Well, Doctor, thank you very much. We really appreciate you, ma. Thank you. This is coming from one of our sponsors for this program, and it's Art Models
Oh.
They're into sales of land, building, and properties. So
Okay.
we're actually presenting this to Dr. Ma.
Thank you very much.
Thank you very much.
Thank you,
So
Act Model Group.
yes.
More this to your elbow. Thank you very much. I appreciate it.